Hello everyone. Today we will be talking about pseudohypertension. So pseudohypertension is a condition where a patient blood pressure readings are falsely elevated when measured with a standard blood pressure curve, but their actual blood pressure is normal. So what happens is in elderly patients or in aged people who are more above 60 years of age, there is arterial thickening of the vessels. So there is thickening of the vessel, and because of this arterial thickening of these vessels or calcification of these vessels, there may be a falsely elevated blood pressure recording with the sphygmomanometer. So what happens is this sphygmomanometer, the cuff which we use normally, this may not be able to occlude the artery. So this sphygmomanometer, how does it work? Is it occludes the arteries, and that's why occlusion only. We then slowly, when we release the pressure, the occluded artery is felt, and then we recorded the blood pressure actually. So because of this calcification or arteriosclerosis due to aging, what happens is that this cuff is unable to compress that artery completely. And that's why it's leading to what is called as falsely elevated blood pressure. However, when you do a invasive arterial monitoring, that is, if you put a catheter in the artery and measure the blood pressure will found to be normal actually. So this is what is called as pseudohypertension. And this is very important because sometimes what happens is that in elderly patient, you just measure with a cuff, and patient may be have found to have a BP of 160 with a cuff. But normally, actually, when you do a intra-arterial hemodynamics, the patient may have a blood pressure of only 120. So if you, by seeing 160, you may start the patient on antihypertensive, and that can be risky for them because sometimes the antihypertensive can lead to sudden hypotension, and they may land up with syncope or falls and all, which can be dangerous for that age group. So Osler's sign is an important sign or important maneuver which is used for detecting this pseudohypertension. So pseudohypertension is measured by what you do in this Osler sign is that first you put a cuff on the arm and you inflate it. You inflate it, and simultaneously you will palpate the radial artery by using your three fingers. You palpate the radial artery. So first you will be feeling the pulsations here. So normally what happens is that whenever you inflate this blood pressure cuff, if the systolic pressure is raised above the systolic pressures of the artery, so what happens, suppose the blood pressure is 120, if you make the cuff inflate by around 140, what will happen is that you will not be able to feel any radial artery here. So you lose the pulse as well as the radial artery will not be able to feel when you increase the pressure. Because of the occlusion, there will be no pulsation as well as the artery is also not felt normally. So now in Hill sign, what happens is that after occlusion, like pulsations are gone, but you can feel the radial artery. So radial artery is still present. So radial artery you can feel still present. So a palpable, although pulseless radial artery, while the BP cuff is inflated above systolic pressures. So pulse is gone, but the radial artery was still feeling. That means it is a positive Osler sign. So what does that mean? Is that the artery is so thick, so calcified, or so stiff that it is palpated even normally also. So even above the blood pressure also it is feeling normally. That means the blood pressure is not able to completely compress it. So that's why it is detectable. So this is a positive Osler sign. So there is an alternative technique which can be used by using a three fingers, where you can use the proximal finger to occlude the radial flow, and the retrograde flow from the ulnar artery can be occluded by the distal fingers. And middle finger you use to assess the thickening of the radial artery wall. And this method is also known as trisection method. So pseudohypertension is a very important condition which we are need to be very careful in elderly patients, which is normally seen in older adults only. So commonly what we happens is the clinician will start them an antihypertensive, and they start complaining of dizziness upon initiating or increasing the dosage of antihypertensive drugs. So while direct intra-arterial measurement is the best method to confirm this, detection of Osler sign can also suggest its presence. Another important sign key, how will you detect that the patient is not hypertensive, is not that there will be absence of any target end organ damage. So that ECG will be normal, there will be no changes of left ventricular hypertrophy. Retina will not show any hypertensive changes. So there is no hypertensive changes in any of the organ, but only the blood pressure when you're measuring, it's getting high. So then also you should think about a pseudo hypertension, and you should be able to recognize this entity carefully because it can be deleterious in elderly patients. Thank you.